Hello, and welcome to CommonHealth, a podcast brought to you by the Virginia Community Healthcare Association, or VCHA. I'm Rae Carkhuff, Communications and Content Specialist, and your guest host for this episode. On CommonHealth, we discuss all things community health in the Commonwealth of Virginia, amplifying the voices of those who are served by community health centers and those who serve them. I am really excited about this conversation. It's been in the works for a while, and we have three lovely guests here with us today from our member center, Eastern Shore Rural Health. Folks, can we go down the line and introduce ourselves?
Sure. Juan Gomez, Outreach Coordinator for Eastern Shore Rural Health.
Jessica Bonniwell, Chief Quality Officer.
Amy Bull, Marketing Director.
Awesome. Thank you so much for being here and giving us your time this morning. So we saw this article in VPM, Virginia Public Media, and this article highlighted particularly the Latina community in Eastern Shore Rural Health. But Juan here had a little highlight in there about being on the Eastern Shore, growing up in the community and seeing challenges and struggles in your personal community that led you to community health. We'd really love to hear more about that story. Can you talk to us a little bit about that?
Yeah, we can talk about. So I grew up. I was born and growing up here on the Eastern Shore for all my life. So attended elementary school, middle school, high school. Once I graduated from high school, I pursued my education at UVA. So I spent a couple of years there, majoring in sociology, and then afterwards, I was still undecided of what I wanted to do. So I looked into public health, which is just working and preventing. What can we do to prevent diseases? What can we do to improve our community? And that stuck with me. I've always enjoyed that aspect of providing back to my community, trying to see what we can do to improve the quality of life that we have here on the Eastern Shore. I think one of the most sayings that we hear is that while we're a small community, there's a lot of services, resources that we provide here within the Eastern Shore. And it's just getting to know that information, being able to spread that information, and let other individuals be aware. So using my knowledge from public health, I like to be able to come back here in my community and just provide a little bit more information on that, being able to see what resources, what services we currently have, and how we can use that to provide a better life, a quality of life for all of our community here on the Eastern Shore. Just growing up, you just want to give back. That's one thing I took from my parents is like, we live here for some time in our lives. We never know when we're gonna be here, and then the next minute we won't be here. But what can we do to leave this earth better than when we came into it? And just coming back to our community, there's been a lot that's happened within our community. We've also had gone through a lot of pandemic in 2020. We could see how all our medical, from our providers, our nurses, custodial staff, how we all just partner up together to provide care for our patients. But not just within our clinics, but even within our community. You would often see many people just honking, just rooting for our nurses, for our providers at the hospitals, and even at the clinics, just giving support for all the work that was being done on the floor, as well other resources that were being available. There were ideas that were coming out of nowhere. It's like, how can we provide uh, transportation to patients? How can we assist with that? Even with groceries, we start to see people that would do transportation that has a small business for transportation, taxi services, but then they even took it to a different step where they were providing grocery pickups for patients, even medication pickups to provide that medication to a patient that would be like a high risk to get COVID during 2020. So seeing all these types of efforts has been great within our community and just being able to, as we all see, a great community that we have here on the Eastern Shore.
Absolutely. Well, I'm just so profoundly touched by the power of community right now, and what happens when we band together and have each other's backs. So you clearly have been hands-on in the community, you came to public health and working with Eastern Shore Rural Health in the pandemic, working hands-on. What is it like day to day for you in the pandemic, or now that we're sort of in a post-pandemic world? What has that experience been like for you on the day to day?
So for day to day, I think first I would like to give a thanks to a wonderful boss that I have, Jessica Bonniwell. She's pretty much allowed me to work outreach in the ways that we're able to partner up with our health education team as well, and just seeing what we can do to our community. Another thanks is also to the wonderful team that we have in outreach. Our team does a phenomenal job. While I may not be in every center every single day, our team is there to serve our community. So right now, a lot that we're dealing with is still the Medicaid unwinding. So many of our patients are currently losing Medicaid, may not have been aware of, hey, you had to change your address. And if you didn't change your address, you didn't get that renewal packet. So we're still targeting our community, making sure that they get the education, the information that if you haven't had your renewal Medicaid been renewed by now, we should be reaching out to the Department of Social Services, trying to get that renewed. If your Medicaid got terminated, what further education can we provide? Can we look to see if you still qualify for Medicaid? And if you don't qualify for Medicaid, let's see if we can get into open enrollment for Marketplace or have a special enrollment period for Marketplace as well. And just trying to help out with that source of information. Along with health insurance, we're also helping with social determinants of health. We're helping our community and being able to navigate the different resources. Many of our patients come into our centers. As throughout the year, we'll be asking them several questions, trying to see what can we better improve their quality of life. If this past year you've been struggling with transportation to medical visits, food insecurities, housing insecurities, what programs do we currently have available that can assist you with these types of situations? So we'll navigate those, assess those applications, start from the bottom if we need to start from there, because sometimes our patients don't even have an ID or their social security card. So we'll start with that step first, trying to obtain an ID, trying to obtain their social security number and their card so that we can further apply for these applications and get these benefits that they may be able to obtain. And so it changes year to year. And then we're also participating in many of our community events throughout the year. We're going, so we have a busy schedule. Pretty much, we started beginning of the year. We're beginning of the year in January, where we're just looking to see what can we do for this upcoming year. What community events are we already made aware or have an idea of when the date's going to be occurring, and we start planning of having our team being out there. Alongside this big meeting that we're having with Jessica, Paige, and I, Paige being our health education coordinator, we're looking into flu clinics. We know the importance of flu clinics in the flu season. So we start gearing up at looking at different companies, looking at different dates that we can accommodate the flu clinics, their locations. We're trying to do block party events as well. So this past year, we hosted our first block party event. And then on top of that, we're looking at our migrant events that we can plan. What health fairs can we do this upcoming season? What late nights are possible for our community? So there's a lot that goes in the day-to-day basis. It's never the same. It's always something new, something challenging. There may be something that Jessica throws me last minute, and it's like, okay, all hands on deck and completing this assignment, and then we'll get back to doing something else, looking at different dates. Sometimes I am interacting with patients where I may just be in the center, and all of a sudden somebody walks in and needs assistance with something. Drop off any projects I'm working on and assist this patient. So one thing that we're always advocating, our patients come first. So whatever we're doing at one point in time, we'll just drop it to take care of this patient. And then we know we can get back to this assignment project afterwards.
Right. Patient-centered is a term that we see a lot when we talk about healthcare, but to truly be patient-centered, like you said, that's when we drop everything and we put that patient first. And I'm just really struck by hearing your day-to-day. Of course, we know that community healthcare is dynamic, but I was really struck by some of the more what's the word I'm looking for? Not mundane, but like there's a lot of like paperwork and forms, and a lot of the help that is being provided to the community is not necessarily the visits with the physicians and the dentist, which is equally important, but a lot of it is, let me help you with this form, let me help you with this application, how do we start at the building blocks and build up? And that's always I don't know if folks really recognize that aspect of community health. But you had mentioned the term social determinants of health. We talk a lot about those at the association, and so Jessica, actually, I'd love to take this opportunity to sort of move into the Eastern Shore demographic as a whole and the population as a whole, and it is such a rich and diverse population. Can we talk a little bit about the population, and then what are some of the challenges that you and your health center see within your community?
Yes, we do have a very diverse population. We provide healthcare to those who are uninsured, underinsured, who are insured, and all levels of income and nationality, of course. We provide resources in English, Spanish, and Haitian Creole to our patients. But with the social determinants of health, we ensure that our patients are screened at least yearly utilizing the Prepare tool. And then that form gets uploaded into the progress note, and our clinical support staff and providers review that. And if the patients answer yes to anything, then we go ahead and have our outreach team, they notify our outreach team at point of care so that we can try to intervene and help them before they leave our health center. And that is probably the most important piece, because a lot of times when our patients leave our health center, we're not able to get back in touch with them. So if we're able to help them right at point of care and provide all the services that they need and make all those connections and provide them with the resources, that's where we find that we are the most useful and benefits the patient the most. Sometimes they're rushing and they don't have time to stay with us, but we're able to schedule an appointment, whether that means we need to come in before they go to work or we need to stay later. We make that accommodation for them. And if we need to work through our lunch so that they can come in on their lunch, we do that. And we try to meet them wherever they are with that, to make sure that they are receiving everything they can, whether it's our outreach services, and our outreach team gets them connected with our case management team or our pharmacy assistant program, or we're so fortunate this year to have expanded into pharmacy, and we get the pharmacist or pharmacy tech involved to help them. Health education has resources as well, and we're able to all work together for the best outcome for the patient. We work closely with our local food bank, so if they do have food insecurities, we're able to give them a non-perishable food box before they leave our health center, but also connect them with any of the patient hubs available that our local food bank has.
Wow, again, just really astounding, all of the different parts of a patient that we're able to take care of through community health, and that you are doing day in and day out. I would love to go ahead and talk about, so we have an array of listeners, and for those who are in your shoes, who are in community healthcare, what are some like creative ideas that you would offer? So you, like you said, you opened a pharmacy. I know that you all also opened an express care location. You started a dental residency program. So you all are moving and shaking and really thinking outside of the box to provide just exceptional care to your patients. What are some creative ideas that you would offer to other rural healthcare providers such as yourself?
I would say first starting with a community needs assessment, trying to see what's out there in the community currently and that we can use. For instance, we have a lot of services within our organization, Eastern Shore Rural Health. being able to provide health education, outreach, but then also there's other health organizations, other local partnerships that we have that offer same services. So we make sure to not try and double dip and offer the same services, but just have a warm handoff to a different partner. For instance, our food bank will partner up with them in being able to provide patients that need assistance with food to our food bank. Additionally, it's just thinking out of the box at times. We're looking at different partnerships that we can do. Using your community partners is very important when it comes to like your local health department, seeing what services they currently have available to provide partnerships. One wonderful thing that we did this past year, for instance, was our mobile unit that our local health department was able to help us out with. Our local health department was able to obtain a mobile unit that they're being able to use throughout the Eastern Shore. And we just had a conversation with them trying to see how we can use that for events that Eastern Shore Rural Health has as well. And was a communication with them, just some talks. We were able to use this mobile unit and going out to our migrant communities. And while we were having our migrant health fairs, we had the mobile unit available to do STI screenings from the health department, but at the same time, our providers were being able to take care of our patients while at the camps. I think Amy also has other points that she can use.
Sure. Just to tag on, and I think that Juan and Jessica are being very modest when they are talking about all of the different connections that they have enhanced or created. I mean, we're talking anything from working with Habitat for Humanity, working with the area group on aging. They're very active in community partners of the Eastern Shore of Virginia. Always, I would call it mining for opportunities to partner, like Jessica said, not to duplicate, but to enhance and to elevate the level of services here on the shore. Also, I think, what I watched them do and what we're focusing on as an organization is just, we see 2 out of every 3 people on the Eastern Shore. And so make sure that we are communicating internally about warm handoffs. And another example might be for our organization is our pharmacy assistance staff will sit there and look at patients that are coming in and find where patients might need assistance with that and make sure that they are offered assistance getting medications that they might not otherwise be able to afford before they walk out the door. And so one of the things that we've really been focusing on of late, and I think will be a focus on in the near future, is just, as our CEO would say, if she was here, polishing our apple to try and just, hey, are we communicating with each other to make sure that our patients are getting the benefit of all the services that we offer?
I absolutely love that little phrase from your CEO. We'll definitely have to put that into my lexicon. So, and speaking of being modest, I would be remiss if I didn't point out, going back to Juan for a second, that last year in 2023, you received a Geiger-Gibson Program Emerging Leader Award. So I'd love to sort of hear about that experience, how that feels and your reactions to that, and then sort of shift that into, emerging leader. We're moving forward, we're growing in leadership. Juan, where do you think, and then we can move into Eastern Shore as a whole, like we're going future forward, where are we going from here?
Like Amy mentioned, right now we're polishing our apple. We're making sure that we walk the talk. We have a lot of programs that we have available here in our community, so we're making sure that we're doing excellent in each of these areas, like pharmacy assistance, outreach, and health education. But going forward, it's the quality of care that we're providing to our patients in general. I think preventative, it all comes down to quality, being able to get in contact with patients prior to seeing their provider, just making sure that they're on track with taking their medications, Even our pharmacy team is helping out with that and making sure patients are picking up their medications. And if there's instances, why is this patient not picking up that medication? Can we reach out to outreach? Is it a transportation issue in regards to that? Could we schedule transportation for them to come to our facility, being able to pick up their medication, and just helping with the social determinants of health in general. Everything is like a looping circle where every small part contributes to the big puzzle. So we're just focusing on that, improving what we currently have, expanding on the services that we're providing from express care all the way to our providers, just in general.
Right. Jessica, did you want to add anything onto that before we close out today?
Yeah, just for future forward thinking, and and polishing our apple and keeping on track with the same set of goals, with focusing on our area in Accomack and Northampton County have the highest rate of diabetes in the state of Virginia. So we do a lot of education within our health centers and in our community, talking about diabetes prevention and really trying to prevent diabetes. So we offer, and we're just recognized for CDC plus status recognition for the diabetes prevention program. We've had that program in English, but we knew that we needed to somehow implement that in Spanish and then Haitian Creole. So our goal for 2024 was to implement one Spanish diabetes prevention program. And then in 2025, our goal was to begin a Haitian Creole DPP program. However, Juan and his team went ahead and they wanted to become certified and lifestyle coaches. So we were able to actually, for 2024, surpass our goal. And we, our health education team leads our English diabetes prevention team, but our outreach team, we have an outreach specialist that is Spanish, and she teaches our Spanish DPP. She actually started her second cohort this fall, and she's had very great success with completion and then an involvement. And we have a Haitian Creole that also started this fall. Through our DPP program, we've had patients that are no longer pre-diabetics. They have decreased their BMI. They've really made lifestyle changes. And that is where we are and what we're trying to prevent, and take a proactive approach. We also focus on a lot of hypertension education, and that goes along with the diabetes and lifestyle changes, and really making that. And then we have a big focus on childhood obesity, and working with our pediatricians at point of care, our health education team, seeing those patients and their families, and and talking about what they're eating and what they're doing for activity and how they can improve that. And it's not, no, you can't eat that anymore. It is more so, let's make a little bit healthier choices. And that's one of those those three: diabetes, hypertension, and childhood obesity is where we came to for our location of our Be Well Block Party last year. And that was our first one. And we had over 370 participants come through, where we were able to provide a vast amount of free services, and organizations, over 40 organizations and community partners came and attended, providing glucose screenings, A1C testing, blood pressure testing. The health department with their mobile unit, we were able to do some breast cancer screenings and things. It was really a great turnout. Really, all of the booths were interactive and talking about healthcare and prevention. And we're looking forward to being able to offer that service again. But with having three of our team members, Juan being one of those, just complete the community health worker certification program, and having that, we're really looking and wanting to get back in the community, right in our rural areas, low income areas, apartments, and communities, and being able to offer screenings and provide that education to them about the importance of immunizations, and coming into the doctor, building that rapport versus trying to figure out what they need and how we can work with them to get them into our health center for a wellness check, to take that proactive preventative approach. We are already working with some of our civic groups, with our health education and case management team, talking about preventative screenings, colorectal cancer screenings, breast cancer screenings, immunizations, wellness visits, and why they are important. Not just telling them this is what it's recommended, but the reasoning and explaining and why. Even taking fit kits out to them when we are doing these education informational events, and really focusing on the prevention, making sure that everyone knows what services we offer, polishing the apple and expanding on our dental services, behavioral health, pharmacy. We are super excited that at the beginning of the year in 2025, we are going to be able to offer a telehealth pilot program in Accomack County Public School System for acute visits. So the idea is when a child comes to the nurse, that we will be able to then, based upon a triage protocol, our nurse that is embedded in the school will be able to determine if they need to see a provider via telehealth. And we will be able to do basic testing, such as strep, flu, COVID testing right there. The machine that we were able to utilize also is a video and camera that the provider can actually see someone's, the child's throat, or look in their ear, hear their heart. And we're really focusing on that because we're working with the school system, because if mom had to go, or dad, parent had to pick up the child from school and then try to schedule an appointment or go to express care, then you have to get medication on board. So the child's going to be out of school longer. So we can help retain them, and maybe them only miss one day versus missing 2 or 3 days out of school.
And that's a major goal of the school district.
Yes. And Juan and Paige both are on committees within both Accomack and Northampton County public schools, which is really important. And we're involved in some of our private schools as well on different committees, and getting into even something as simple as reading to students in the elementary schools in the library. So it's really important, and we're really just looking to be able to make sure that we're able to meet all of our patient needs and make sure that that we have that rapport with them, and they want to come to us and feel welcome, and us be the provider and the community partner of choice.
Right, absolutely. Well, seeing two out of 3 people on the Eastern Shore, you're definitely on your way, and just hearing the way that you are just being so present and public in the fabric of your community is just so wonderful. Part of CommonHealth is that we amplify the voices of those serving in community health. So I am just really glad that you folks came on today and gave us some time to let us, like Amy was saying, toot your horn a little bit more, shout you out. You are clearly doing such magnificent work out there on the Eastern Shore. And I don't know about you listeners, but I loved hearing every second of this. So folks, thank you so much again for your time today. And we were at your first Be Well block party last summer. So we hope to see you again this upcoming summer. Such a fun time. And thank you again for your time today. I want to thank our guests for joining me today. And thank you all the listeners for tuning into CommonHealth, brought to you by the Virginia Community Healthcare Association. If you enjoyed this episode and you'd like to help support CommonHealth, I encourage you to hit the subscribe button and share with others on social media. Leave a rating and review, or visit us on our website at www.vcha.org. This is Rae Carkhuff. Thanks for listening.